What could be done to improve mental health services in Canada?
That's a really good question. A lot more funding. I'm somebody who was diagnosed with generalized anxiety disorder and OCD. So definitely a lot more funding towards programs that are specific to each mental health illness, just because, everything is kind of more directed to depression specifically, and doesn't really take into consideration everything else. So more direct groups kind of formation, I guess.
I think just implementing a lot more advocacy, especially within youth. I think there's still sort of this stigma that it's something you could sort of work through, or it's something that you should be frowned upon, or something that most people deal with, but just have a better backbone. But in reality, everybody has their own obstacles, and nobody really takes into account just how hard it might be for one person. So I really just think sitting down people and advocating for the fact this really is a mental illness.
Further investments are needed in every area, whether that's acute care, whether that's in being able to provide psychiatry services. And I think that a strategy is needed on a federal and a provincial level. It's just a wide field that needs to be covered.
Acknowledging mental health as a real disability, I think, is super important. I think a lot of people kind of bypass it or see it as less kind of important as kind of like physical health. So kind of just like acknowledging it more, I think.
Quite a bit. I think first off, for like Indigenous people, there needs to be a lot more resources available. I also believe that there still needs to be destigmatization of mental health issues, and I think there needs to be more of a proliferation of mental health services in smaller towns.
I think the first thing to do is to stop taking the police out of the first response equation when it comes to mental health crises. But I think there also just needs to be better supports for mental health. I think there needs to be a lot better that I know that my own mental health has deteriorated. I see evidence of my growing depression. I've always had a bit of depression. It's worse at the moment. I just think that there needs to be better supports for people who are in crisis, especially when they're in crisis, but in general as well.
I'm a person that does deal with mental health issues, so I've been lucky enough to be in person when I go see my therapist, but I know that a lot of people can't, or they're taking extra precaution because they have family members who could get increasingly sick. So actually what I think she said, that having the opportunity to meet someone outside and talk to a therapist or talk to someone, so that way it incorporates getting outside as well as being able to see them, because Zoom is one thing, but being face-to-face is so much different, because Zoom can lag, you can have Wi-Fi connectivity issues, and there's a huge difference between being face-on-face with someone or being on a video call. Yeah.
More social programs. As somebody that's struggled, if you'll say, it's good to see that we're seeing an uptick in that, whether it be in the corporate front with provided benefits, things like that. At least I know that with the corporation I work for, it's been an encouraging thing to see that increase year over year. And conversation, I think, not being afraid to have open conversation, that it's safe and it's a safe environment to vocalize your needs if you're struggling.
In terms of medical insurance, if going to a therapist and everything, it could be insured and covered. I believe that everybody needs a therapist for mental health and mental issue. It needs to be, we need to raise awareness for our mental health issues. And I think it's really important.
What can be done, because for example, for my employer, there's a lot of talk about mental health, constant meetings and discussions, but I know my colleagues wanted to reach out and actually get mental health help and assistance, there's barriers to costs, because if you go and see a professional, even a best employer will give you only a few sessions, and then these people were then later on had to pay out of pocket, and they couldn't afford it, so therefore their mental health may be improved slightly, but not enough.
We need more people, more volunteers, more outlets for these people. Go out into the community and talk to them. Don't wait for them to walk into an office or an outlet or a tent set up in somewhere. You have to go out and find them.
The outreach, for me personally, it's more cultural than anything else. Being Asian, it's hard to find mental health workers for Asian communities. So I think a big focus on that.
Maybe offering a line of service where you can access freely, because I think the communities that are most impacted by the pandemic are the ones with the least resources. So that would be a good way.
The most important thing is probably reducing stigma and recognizing how prevalent those issues are amongst society and all sectors. I think a particular attention is probably going to need to be paid to younger people in society who might have less of an ability to rationalize what's going on.
I will say though that the quarantine definitely doesn't help. That I consider myself a pretty stable person, and even I'm having trouble during quarantine, just staying positive, and it's very hard. And I can imagine someone who already has mental health issues, just being at home and on their own, it really doesn't help. It's very it's dangerous for sure. Quarantine is not good.